welcome to another exciting episode of MedSynapse podcast series. I'm your host, Hetvi, and today we have the privilege of speaking with an expert who brings a wealth of knowledge to the table. Joining us is Dr. Saloni Vora Gala, the medical head and a highly accomplished clinical and cosmetic dermatologist at Dr. Sheth's Skin and Hair Clinics in Mumbai. With years of experience in both clinical dermatology and advanced cosmetic treatments, Dr. Saloni is well known for her personalized approach to treating various skin and hair concerns. And today we'll be diving into the fascinating and ever evolving world of hair restoration techniques. Hair loss is a common concern affecting many people worldwide, with various underlying causes and a broad spectrum of treatment options. And to shed light on this concerning topic, we have Dr. Saloni with us. So, welcome, Dr. Saloni, and it is a pleasure to have you with us.
Thank you so much, Hetvi and MedSynapse. And thank you for that beautiful introduction. And it's my pleasure to be here today to discuss about hair, which, like you rightly said, is a growing concern every day.
That is so true. So, now to start with, can you give us a brief overview of the common causes of hair loss that you encounter in your practice? And have you noticed any emerging trends or new causes of hair loss recently?
Yes, of course. So there are multiple causes of hair loss. The most common being genetic. I see a lot of men and women who have a history of hair loss, hair thinning on either their mother's side or father's side. Another important cause and most common is nutrition related. In our busy lives, we often forget to eat well. We forget to sleep well. We forget to sleep on time. You know how we are addicted to Netflix and Hotstar at night, and we sleep really late. And that has become one of the leading causes of hair loss these days. On top of that, we often include vegetables in our diet. We often eat our roti and rice, but we forget proteins, especially those who are vegetarian. Those who eat non-veg will still include a little egg or chicken in their diet. However, as vegetarians, I am also a vegetarian, and a few years before, even in my meal because our protein sources are so less. Other than that, the amount of basically hair care, the amount of heat styling, and the amount of treatments that we do to our hair also has contributed in some or the other way to hair loss. Plus hormone changes, again related to lifestyle. I see a lot of women and young girls coming to me with PCOS and hypothyroidism. Even men these days undergo so much hormone imbalance that they often start losing hair very often. And when it comes to an emerging cause of hair loss, I would only say one thing, and that is stress. Stress right now is the most common cause of hair loss that I've been seeing these days.
Yes, that is so rightly mentioned. It is like stress plus environment plus diet plays a big role. And I think even a
Lifestyle,
younger
basically.
generation, this like recently have started like, for example,
Yes,
even me, even I am facing so much of hair loss, which is like in a younger generation, so much of
yes.
because of the lifestyle for obvious reasons. So yeah.
Yeah, in fact, you won't believe every day, and I have so many young girls, and I have to really start on hair regrowth therapies for them right in their early 20s. So this has become very common now.
Yes. And also concerning topic at the same time.
Absolutely.
So now coming to the next question was, what are the most significant breakthroughs in restoration over the past few years, and which new techniques or treatments are showing the most promising results in clinical practice?
So, see, there are again wide, like many treatments for hair regrowth, surgical as well as non-surgical. Surgical, obviously, we have the hair transplant, and there are many new techniques in hair transplant which has made it a little easier and more comfortable nowadays. So that is one, but not everybody wants to undergo a surgery, and not everybody needs surgery when it's they're just in their early stages of hair loss. So then there comes the non-surgical procedures, and I my largest practice is of non-surgical therapies. I don't really go into surgical procedures. So there, I mean, PRP has been going on since many years now, but now we have many advanced technologies in PRP. There's something called as growth factor concentrate, which is working wonderfully. It is a step higher than PRP. Same thing, we remove growth factors from one's own blood, but the technology has advanced so much that the process has become easy, less discomforting, less painful. Then there are many growth factors, growth factor boosters that have come, which have changed the scenario in hair growth, and it is actually working very well. Then there are these latest therapies which involve extracting growth factors from one's own fat cells. Then there's something called as exosomes that has come. Of course, these treatments have to be combined with oral medication, topical solutions, and lifestyle changes.
So a lot of factors come into
Yes,
consideration
there
when
are
we
there
are.
are many treatments to choose from now.
Yes. So also on that note, combination therapies have been making headlines recently. So what are
Hmm.
your thoughts, and what combination therapies are currently proving to be the most effective for hair restoration? And are there any specific pairings of treatments that yield significantly for better results?
Yes, so I strongly believe in one thing, whether it comes to treating hair or skin, holistic approach. Single therapy, monotherapy does not work anywhere. You always need combination. And in my practice, I combine three things. One is lifestyle changes, which are the most important. Otherwise, as a patient, you will run to 100 doctors and you will not have results, even if the treatments are the best and you spend lakhs of rupees. Secondly, oral medicines and topical solutions. Very, very, very important. The kind of medicine, the kind of supplements, and the solutions can change according to one's requirement, age, need, everything. But it is a must. Third, external therapies. Like I said, there's advanced PRP, that is growth factor concentrate. There are boosters, there are exosomes, whatnot. So basically, combination of these three things work wonders. And if you ask me, any two things that have worked very well, one is topical solution. Okay, if it could be topical solutions in my practice are usually a combination of minoxidil with hair growth booster, that is peptides, and combining with that, I generally do an external treatment. And that again is a combination of GFC with certain boosters that I actually inject into the scalp.
That's a great advice, I would say, and a mixture of a lot of things, like you
Yes.
mentioned, like a holistic approach is necessary. Now, can you share some case examples where new or emergent treatments have dramatically improved patient outcomes, and what were the key factors that contributed to these successes?
Sure. So here I would like to share an example of one of my patients who does not live here. She lives abroad. She lives in the US. She studies and works over there. And obviously, when you're abroad, your availability of medicines is very challenging because a lot of things you don't get over the counter in the US. Here, it's still a little easier. It's easy to take an appointment with a doctor. In the US, it's not, and it is very expensive. So she actually visited around five, six doctors already. She spoke to them online and she did not get any results. She must have tried n number of vitamins and supplements and topical solutions, but things did not work out. So then somebody recommended our clinic to her. And one fine day, she did an online consult with me. And while talking to her, what I realized is that her lifestyle was an issue. Okay, she didn't realize it wasn't her fault, but I mean, our lives have become very stressful. We have work,
True.
we have studying to do, plus living in the US, she had to do everything by herself. So it was unfortunate, but because of her hectic schedule and her lifestyle, she developed a major hormone imbalance. And when we got her sonography done, we found out she has PCOS. So then I got her onto meeting a nutritionist. I got her onto seeing an endocrinologist to get her hormones corrected. And I started her on some exercises. I gave her a contact of this trainer Online she would, do a personal with a personal trainer, she would exercise that. Along with that, I made her start with just two simple things. One was the right hair supplement, something that she could easily get in the US, and I sent her one medicated oral supplement from India and one hair solution. She came to me, she flew to Mumbai 6 months later. 50% of the job was done just by improving her lifestyle. And when she was in India, she was there for about 2 months. I started her on some external treatments. I sent her back. We did some 2, 3 sessions. We couldn't do more because of the limited time.
Mm.
I sent her back. I asked her to again follow the same thing. She came to me another 6 months later, that is a total of 1 year later. You won't believe she had recovered almost 70% of her lost hair. So that is the power of holistic approach and the finding the root cause of the problem and treating it.
That is so rightly mentioned. Like finding the root cause is so
Cause.
important because also it also depends
And
on personal.
consistency, mainly consistency.
Yes,
See, what most people do is they are eager to start treatments. They start, they do it for 3, 4 months, and then they get tired. They become irregular. Now, one thing one needs to understand is maintaining hair is a lifelong process. So consistency is important.
definitely the consistency, the right kind of guidance is also important sometimes.
Yes.
So yes, a lot of roles play come into consideration, I would say. Also, one more question that I just that was just arise that there are so many hair growing serums and everything in the market recently. So
Hmm.
are they actually something that really works for you, or is that just a marketing strategy?
See, there are two categories of hair growth solutions that are available. One are pharmacy based, pharma company based, okay, which are actually the right ones because a lot of research has been done. There are lots of studies that have been conducted, and not studies in like 10 or 20 patients, but thousands of patients, thousands of study groups. Okay, they are evidence. They are called as evidence based medicines, something that we
Mm.
prescribe according to the patient's need. And then, as you know, I think since the last 5, 6 years, social media has been so influencing that every small company is coming up with their own hair growth solutions, but they don't always work because there is first they have not been studied upon properly. There is no evidence to prove things. There are so many hair solutions which have just onion oil and rosemary oil and whatnot. See, I am not against onion oil or rosemary oil, okay? But they have their limitations. They may
Mm.
work to certain extent, say maybe 5%, 10%. But they have to be combined with proper medicated, well-studied ingredients and growth factors, which have been scientifically formulated. So, yes, some work, some don't.
Yeah, actually, it also depends on a lot of studies, and sometimes it's just, as you mentioned, social media does create the
Exactly.
influence. So,
Exactly.
yes. So, now the final question is looking ahead, we know that there is so much research happening in hair restoration continuously. So, are there any new drugs or systematic treatments in the pipeline that could revolutionize the management of hair loss? And how do they compare to existing treatments in terms of efficacy and safety?
So, recently, one drug has become very popular with dermatologists, and that is something called as oral minoxidil. Now, we all know about minoxidil. We have been using it for years. You must have heard so many friends and family using minoxidil solutions. Now, oral minoxidil has been given since is being given since the last almost a decade. However, initially it wasn't very popular because there was not so much evidence. Originally, oral minoxidil tablet was being used to treat blood pressure. Okay, but since the last decade, uh, in the small dosage, in a very small dosage, it is also found to be useful in growing hair. So now, in the last 2, 3 years, especially, more and more dermatologists are actually prescribing oral minoxidil. I'm not saying that it is for everyone, but from my experience and from what the studies say, it is quite safe for a lot. of the population, not for everyone again, but a lot of the population. Yes, this does not mean that somebody can just pick it up over the counter and use it, because it, like every medicine, it also has its own negative effects, side effects. So as dermatologists, we actually choose our patient and give it to only those particular group of patients. But yes, it has been doing wonders. And when it comes to treatments, external treatments, in the last 1 to 2 years, in India especially, we've been injecting anti-hormones on the scalp. They have been working wonders. And the latest technology, exosomes, which are actually cell messengers, they have been very helpful in regrowing hair. These are some of the latest technologies, and we are still studying them.
Yeah, these are so effective, and it is so
Yes,
exciting to hear such new and promising results that are going to
yes.
come. So, as we wrap up today's session, thank you so much, Doctor, for sharing your expertise with us today.
Thank you so much for inviting me, and I think it was really fun chatting with you.
Thank you so much. And your insights into the latest hair restoration techniques have been incredibly valuable, especially I'm sure it would be
Thank
for
you.
our audience and for me as well.
Thank you so much.
And for those tuning into this episode, we hope you found this discussion as lightning as we did. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource; it's a dynamic space where you can connect with the medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay aware and take care of your health.